Okay.
feels good to be to be in a place where I thought about being, or just imagining that before surgery and during surgery, and feeling like it would take forever to get here. It's nice to be here.
Yes, yes, and a pleasure to bring you on. So I will go ahead and get started. We have the other, we are doing a Facebook Live, Instagram Live, TikTok Live, and YouTube Live. So we can reach the many different members, new listeners. We want to welcome all our members on our private breast implant illness support group page as well. This movement, if you will, is by the ladies, for the ladies. This is your chance to talk to the many other young moms, and certainly the other many patients who are hurting, who are looking for answers, so you can explain your journey to them so that they can connect with you. This is the phenomenon that we are seeing day in, day out. Like the lady from Scotland today, the other nice lady from Pennsylvania, the other lady from local, who went to their respective plastic surgeons, and they were told that we can replace them, i.e. put another set in, and the patients knew better. They did not want to deal with it. So having said this, we will hear from you. This is Dr. Khan, Executive Plastic Surgery. It's a pleasure to welcome one of my former patients, Taylor. So if you could please introduce yourself and tell us your journey. So I will just go ahead and get started with the basic set of questions. So if you could please tell us more about yourself, where are you from, how old you are.
Yes. Hi, everyone. My name is Taylor. I'm from Arkansas, and I'm 30 years old.
Okay. When did you get your augmentation?
I got my implants in 2017, the end of 2017.
Sure. Now, this is your one and only set that you got. These were below the muscle. And how many cc's were they?
They were 350.
Yes, 350 cc's. Now, when did you realize, when did you know that the implants were causing, or the implants needed to be removed?
Probably around the 6 year mark.
What led you to believe, or what made you realize that you needed to remove them just 6 years into your augmentation?
Well, the whole the beginning of the 6 year, I started feeling this tired, overwhelming tiredness. That I couldn't shake, and a lot of that, it went back and forth with thinking it was just from being a new mom, or being a mom. I had being a mom, being tired all the time. I had a lot of reasons to be tired, but there was something that just felt off. It didn't matter how much sleep I got, nothing seemed to help, and I looked into it more. I went to the doctor, and they told me the same thing. Oh, you're a mom.
No, did you go to your plastic surgeon, or did you go to your primary care doctor?
Primary care.
Primary care doctor. No, I just want to mention. So this fatigue was the symptom you mentioned. What other symptoms, if any, did you have?
I had the tiredness. I had dry skin, a lot of dry skin. I also had heart palpitations. Um, Other things. I just felt like I couldn't stay hydrated. I would drink water all the time. I couldn't be hydrated. My mood just fluctuated all the time.
Got it. So yeah. Now now I just want to mention that sometimes when you go to the emergency room with these complaints, which can be like very, I use the broad non-specific. The emergency room is thinking, making sure you do not have an arrhythmia. Some people, believe it or not, do the 5 hour energy, or do those energy drinks. They have arrhythmias, right? Young people, young patients such as yourself, they're thinking, kind of ruling out the obvious, right? To making sure that they look at the heart. Do you have any congenital problems? Obviously, it is very not normal for someone young like you to be presenting with these arrhythmias. Now, fatigue, relatively common. Some people will say you're stressed out because being a mom is a 24/7 job, right? Now, I just want to mention, when you go to your primary, the primary cannot weigh in and say if it's the implants or not. Now, if you ask me, about, let's say, looking at a child or allergy immunology or rheumatology, I will say, yes, I'm a physician, I'm an MD, I'm a doc, but my input is going to be not significant. It's going to be limited or none. And I will say, I will be the first to say I'm not an expert. Likewise, I wouldn't expect the primary care doctor to weigh in and say, well, it's the implants or not. Because some of the primary, a good number of the primary have not even possibly touched an implant, right? Let alone deal with the patients with their problems with implants. They do not even know that they are not lifetime devices, right? The longer patients have them. And what is very interesting, anecdotally from my experience, the patients 7 to 10 years is when they start becoming reactive, plus minus, sooner or later. So just today in my clinic, I had a patient that I took care of last week. She had implants from 1990, 35-year-old, and they were intact. But she knew she needed to get them out because she knew that it's not normal and healthy. She did her research and she knew she was going to only remove them. So this is, again, you had these cues. And now when you went to your doctor and you were told otherwise, right? What led you to believe that it was indeed the implants?
I guess I just, I did more research and I saw, other people having similar stories, going to the doctor and their labs were normal, but still having them persistent symptoms. I joined a bunch of groups, your group, other groups, and I just, the compelling stories that were so similar with similar symptoms, I was like, this has to be it. And I think I just did it so, soon when once I realized that is, for one, I was breastfeeding, and my timeline was going to be longer because I had no idea that that was possible. I wouldn't have ever thought it was a possibility to explant while breastfeeding, and then I saw other people in the groups talking about it, so I did more research and saw that it was possible. So I'm really excited to be here and kind of talk about that and show a realistic side to that.
Right, and very important. So I remember when you told me you were nursing, I look at it and I've taken care of a lot of patients, well over, I would say, 10 to 15 thereabouts over the years. I would say more in the 10 category, 10 number, where the patients, the moms, were actively nursing. So they would nurse in the morning, the surgery would happen in the afternoon, and later on in the late afternoon or early evening, the breast tissue would get engorged, and then they would nurse or pump. They would pump because their child would be basically back home or elsewhere. Now, the other thing I want to mention here is, in majority of the cases where the implant is below the muscle, my incision is only horizontal, and as soon as I make cut, I always go below the muscle, so the breast tissue above the muscle is not touched at all. And for that reason, the moms can go ahead and nurse because the nipple areola, breast tissue, and the muscle above is not touched. So that compartment, if you will, P1, if you will, above the muscle, above the pectoralis, P1 is not touched. And I'm always at the P2 level, that is below the muscle. And this is where I don't cut the nerves, I don't cut the ducts, I don't cut around the nipple areola, I don't make a cut up and down and an unsightly scar above and below. I do not cut into any of the breast tissue because I do not want you, when you become 40, to basically have an altered mammogram, because now there are cuts around, to have altered nipple sensation. Sometimes some moms cannot, if the cuts are made around the nipple areola, you can basically disrupt the nerves and the duct supply, so that if they will not be able to nurse. So anyone who has had a mastopexy, you will see the surgeons will discuss, there might be a small chance, 10-15% plus minus, depending on a young mom who may not be able to nurse. And that's why I do not make any cuts around the nipple areola up and down. I only make the horizontal cut right in the crease and an incision that hides. And as soon as I make the cut, I'm always on top of the capsular tissue underneath the muscle, away from the breast tissue, so that I remove the entire implant capsule completely, sincerely, faithfully, and always staying in that P2 section such that the breast tissue is not touched. And so that's why later on that day, in the early evening, late afternoon, you were able to basically pump. Now, let me ask you this. How much discomfort or how much hurt or how inconvenient was it for you after your surgery that day when you had to pump or nurse?
It really, I mean, wasn't as uncomfortable as anticipated it to be. I mean, it was, there was some slight discomfort. You know, my nipples were sore and uh, I felt I had like some numbness sensations on the side, but there wasn't a lot of discomfort. Pumping felt it all. It was relieving to when I was a George to be able to do that. It wasn't as uncomfortable as I thought it was going to be.
Got it. Now, the one thing I want to mention is, you are not that big. Your frame is small, and you had what were 350, which were relatively very large for your chest width,
Right.
right? So you had, relatively speaking, very large implants. Now, you were able to, now remember, if you were able to nurse before, you were going to be able to equally nurse after, because remember, I was not touching the breast tissue at all. It is irrelevant to me. It has nothing to do, I have nothing to do with it, and I'm not going to cut into. And so that's why, in a very meticulous, cautious way, I was able to do the dissection such that all of the implant, capsular tissue, inflamed tissue was removed as one system. What is below the muscle, right on top of the rib, and especially you with the low BMI and young patient, it was going to be harder for me, because any time of the day, that 78-year-old patient, my very first patient, the nurse that I operated on last week, she was a very easy patient because she had only one implant. She had an implant done by a very qualified plastic surgeon, and she had a reasonable size implant. It was done right, and it's a lot easier dissection on someone older than someone younger. And so the fact that you were right on top of the rib certainly added to the challenge of the surgery. The large implant certainly added to the challenge of the surgery. The amount of inflammation that was present also added to the challenge of the surgery. Your low BMI certainly added to the challenge of the surgery. But it was done because I take care of the patients from all walks of life. Now, let me ask you this. Before you decided to come all the way from Arkansas, how much research did you do?
A lot. I actually talked to a couple other surgeons, but they wouldn't do it while I was breastfeeding. It was their recommendation to wait 6 months until I was done. But I had no idea when that was going to be. That was, I just didn't want to wait that long.
Right, right. Now, let me ask you this. Before your surgery, and I'm just looking at the records here, your surgery was done 1/21/2025, so earlier on in the year. Compared to, let's say, New Year's, and now, how much improved are you?
But I mean, a lot, very much improved. I mean, I have so much more energy now. I can get and I sleep better. I sleep so much better. I think that was a problem too. It wasn't that I was just tired all the time, but I had trouble going to sleep, staying asleep. I don't have any of that anymore. I'm able to go to sleep easily. I wake up, I have more energy. I don't have headaches anymore. I'm able to stay hydrated, keep up with my kids. I feel so much better. Another interesting thing, before I got my implants removed, my baby was sleeping with us because he was feeding all night long. And despite him feeding all night long, I would still wake up with faults in my breast that would be sore and hurt all the time. I haven't had that happen one time since surgery. Even with wearing the binder after surgery and not, I immediately cut out the night feedings. So no night feedings, the tight compression, and I still didn't get a clog.
Nice, nice, nice. Very important. I'll tell you, all the other previous patients who were nursing, they had no problems nursing. The fluid, the milk did not accumulate in that dead space, if you will, where the implant was sitting, and the compression can certainly work very effectively, very safely, and very definitively. I just want to mention, when it comes to compression with the bra and the binder, it is very much the standard of care in plastic surgery. If you were to get a tummy tuck, you have to wear a garment from your mid thigh all the way up to your upper chest. If you have to get an arm lift, you have to wear a wrap around your arms. Thigh lift, you have to, So this is very much consistent with plastic surgery 101. You have to have compression after any of these surgeries for 6 weeks plus minus, and especially after an explant. And certainly the compression can be done relatively very safely, wisely, definitively, and needs to be done. If you don't wear the compression after an explant, this is only going to lead to more problems like seroma. Just like after a tummy tuck, you have to wear the compression. Now, next question for you is, when you made the trip, like what did you do? How did you prepare for the trip? So that for those young moms who are coming with their kids, yeah, so that they can learn from your experience.
Well, I made sure I had support. You know, my husband's very supportive. He came with me. We have an older child who's almost 4. He stayed with my grandparents, or my parents, grandparents, and we brought our youngest with us. He was still feeding, and so we brought him. My husband was there for support, but other than that, as long as you have support, I think preparing mentally is, I mean, really important. And I did a lot of that because with surgery, there's always risks. You know, my goal was to continue breastfeeding, but I also had to prepare myself mentally that that might not be the end result. That I had, and I had to be okay with that. You know, my body might respond differently for whatever reason, and I had to know that that was possible. And I prepared myself mentally, you know, just for the surgery, for the discomfort, for all the mom heartbreak of not being able to hold him, and how our, you know, our relationship, our bond, all of that changes. And you know, that was hard to come to terms with, but he actually, you know, he adapted so quick and so well, and he did better than I anticipated him doing.
Right. No, no, I will tell you, it was very cute. I remember a very cute baby, and I will never forget. Now, question, is he still nursing?
Yes.
Yeah, and this is where, look, you continued on, from the medical perspective, and again, I'm not a OBGYN or a pediatrician, but it is very well established in medical literature that there are textbook worth of benefits when you nurse. And this is where the nursing should continue. Now, imagine you had not explanted yet. You would have had all these months of continued, quote, lack of a better word, misery and ill health and the BII, breast implant illness symptoms. And so you were able to overcome. Now, remember, you and I talked about it. Ideally, so there was another patient that I talked to, and I talked to young moms, and she had expressed that she was going to wean off in the next month or two. I said, listen, no matter what, you don't come to me next month or two, you're better off coming to me having weaned, because you're in the process of weaning. And so that is a no-brainer situation, because you don't want to be dealing with potentially nursing now. But if you are continuing to nurse for another 6-8 months, a year, I say, and depending on my phone consult with you, I will get a good understanding of this. So I give you the then green light to proceed, so that, having done plenty of these. Now, I remember the first one that I was doing, there was another young mom that came to me, and she actually had a ruptured breast implant, and she said, I want these out like tonight. And she got her the clearance because she had a ruptured implant. There was an urgency, and she took the next available date, and she was concerned about if this is going to affect like the post. I said, no, we will continue. And for me, it was not like much of a choice, because she really said that she wanted it out. And certainly, if someone finds out that the implant is ruptured now, there is no reason to wait. There is an urgency into removing. Now, this is where, if I know that I'm going to get sick tomorrow, and I know there is an antidote or a ointment or a medication I can take, and I'll be feeling better by the end of the day, I will take it in the first second that I can, because I want to feel healthy and better and more organic and normal. And so this is where I said to you, we will go ahead and proceed with the surgery, even though you're nursing, and I will follow you very closely. And you did a wonderful job. You understood what I said. You're very confident. I was able to work with you back and forth, and you were truly well informed. I could tell you had done your homework. All the patients that I said I took care of today, they have read into, seen my Facebook, my YouTube, my Facebook page, just like you. They were very well versed, and they truly felt comfortable. And as you will see, most of the patients are not only nervous, which everyone is. You know, if you were to be getting a root canal tomorrow, or I would be nervous, right? Or a colonoscopy. Now, this is a big deal surgery, but this is gives you the peace of mind and contentment, and you were actually excited that you were looking forward to your surgery, so that you knew that you were going to get better. Now, let me ask you this: how sure were you that you were going to get better?
I probably wasn't as, I mean, I was hopeful. I was really hopeful. I mean, everything I read and the stories all pointed to it, but I think, I mean, there's always still that uncertainty. Like, I think we all still feel that. And I also wanted to be realistic. I didn't, at the end of the day, nothing is, the end all be all. We have symptoms and they can definitely be debilitating and take over our life and our health and everything else. But, when we get them out and we start getting, our sense of self back, we still have to put in the work. We still have to put in the work to feeling better.
Right, right, and very well said. Now, the other question I have for you is, now it takes a lot of, I use the word guts, determination, motivation, support to come here with your cute baby and your husband, and to be away from your 4 year old. That's not to be taken lightly, right? And then to make the trip, and then post op, you know that you're not going to be able to carry him, right? Because that's part of this post op. You know, you do not want to use a muscle underneath which the whole dissection occurred, just like because you do not want any issues. And I have to say, I told you can get a sling and then put the baby on your arm such that the sling would carry the weight of the baby and not your arm. So that is one trick. Or you could be laying down and someone could deliver the baby to you in your hands and arms, and that way you'll be sitting, and that you can just cuddle around, not using the pec major muscle, and you could still nurse in a very safe way. You could pump, and then feed the baby such that the baby would get the nutrition that he or she deserves, so that you continue on despite an explant, and you can do it, and certainly in a very safe way. So far to date, I've not had a single patient where the milk accumulated in the dead space, the third space where the implant was sitting, because I never entered that compartment. Now, what do you have to say to those young moms who will say, well, you might be feeling the pain after, like you might, because in itself is a challenge, and now you have to unzip and nurse a few times per day for 6 hours apart. What do you have to say to those moms, and now that we look at your experience?
Just regarding the pain.
Yes.
I mean, really, it's worth it. I mean, it's overwhelming sometimes. It feels like, another thing you have to do to heal. I know a lot of people told me, like, I don't know how I can, just from their experience explanting without breastfeeding. A lot of people said they couldn't imagine doing it or having that on top of healing. And, it is a lot to think about. But I think as moms, you want the best for not only yourself but your kids. I mean, it kind of motivates you to do hard things and to put in the work to make that possible. I knew I wanted to feel better, not just for myself, but for him. And I was also, obviously worried about what if I was having so many health effects, what was that going to do to him? And I kind of wanted peace of mind to continue our journey.
Right, right. No, I get it. Now, the next question for you is, I kind of asked you this earlier indirectly, but let me ask you this: compared to before, in January and now, how much better do you feel? Like 50%, 70%, 90% back to like when you were before implants? How much better do you feel overall?
I think I was definitely like 90% up there. I mean, I feel so much better. I mean, I still, I'm working out now. I'm able to hold him. I haven't had any pains or really like any. I haven't had any big setbacks. Um, I've just been able to move forward and focus on my healing, and I feel so much more, like my normal self. Where like I kind of like I picked up where I left off before I had the surgery, but everything seems so much brighter.
Right. No, good, good, good. I can see your face. It is glowing. and you can see the ill effect of the implants on your face from before and now. I'm sure your friends and family notice that.
Yeah, 100%. People are like, you look so much better. And even people, I mean, I'm small already, but people I don't see all the time that I run into are like, you look so much smaller, you look slimmer. And I'm like, it's just inflammation. And well, like we've already stated, my breasts were way too big for me, anyways. And so taking that off,
Sure.
they didn't fit me.
Yes. Your neck, back pain, I'm sure it's also improved, and you're building those.
That was a really big thing that I haven't mentioned, but that was the first thing I noticed was the tension in my shoulder blades. That was always there. It was constant. That's been gone since right after surgery.
Right. Now, just every single patient who has implants will have some sort of a mechanical weight effect on the neck and back just because you're carrying these implants. If you hold the implants in your hand, they might be okay, they're heavy, they're okay. After a minute or two, they will get heavier. After 5-10 minutes, you might not be able to even hold them. Now, your neck and back, you have the weight of the implant, especially you when you have a small frame. Number two, the inflammation that's brought on, some less, some more, some not at all. But that in itself will add to the fibromyalgia type of issues, right? And so this is where just the sheer mechanical weight of the implant being gone, your posture is going to change for the better. And I can only imagine that. And so, yeah, so this is very certainly you saw improvement. Now, how soon did you notice the improvement after surgery?
For what?
For like overall the symptoms of like say the neck back pain, the other symptoms of fatigue.
The neck and back pain was almost immediate. That was the first symptom I noticed. You know, I kept waiting and to see if it would just, but it never came back. And that was the first thing to disappear. I want to say the next day. I didn't notice it. The tiredness took, I think, I want to say like a week. Just, I mean, I was recovering from surgery, so, you know, a lot of things come with that. But the next week or two, I started noticing slowly, you know, other symptoms like not being tired, not having as many headaches.
Right. So this is all these symptomatic improvements. Now, the how much pain medication did you use after your surgery?
I didn't use any pain medication.
Right. Now, did you get Exparel or no? No. And so this is what I want to share with my patients. The question is to give the pain medication narcotic because you're nursing, right? We do not want there's the question mark. Now, I will tell you 2/3 of my patient, if not more, do not need much, if any, pain medication at all. And this is,
Talk about that.
yeah, and so this is where, you want to be always cautious what you're going to give for pain, but this is where you have the peace of mind as you go into the surgery that most of my patients, 2/3 easily do not need much of pain medication, maybe 1-2 days worth, if at all. And sometimes some patients text me and say, well, you gave me so much, do I even need it? And I say, absolutely not. If you don't need it, you don't. There's something called pain and there's something called soreness. So no pain meds for soreness, but pain meds only for pain and maybe first or second day. And this is where those patients that are basically have pain issues in the past, they are very good prime candidates for the Exparel, which is the very nice, good nerve block for the 72 hours that it lasts up to 3 days. So that just like when you go to the dentist, you're numb for like 4-6 hours. In this case, you're numb for up to 3 days after surgery, and it certainly helps a lot of patients. Now, now the how long the very important thing that you and I talked about as I basically discharged you was to start the weight, and I certainly did not recommend. I said it's required so you can build up on all those muscles as you get older, your neck, back, shoulder muscles, your pec major, pec minor, latissimus, deltoid, serratus, suprainfraspinatus, all these muscles of the neck, back, shoulder. And I tell my patients a month and a half out, go ahead and go to YouTube and type in upper neck, back, shoulder exercises so you can do all of those so you can build up on those muscles which truly were not working when the patients had their implants. Because because of the sheer weight or the inflammation, the patients are limited into the athletic capabilities that they have. Now, let me ask you this, all your symptomatic improvement, could that be a placebo effect?
I mean, that's always possible. I mean, but I think I've thought about that, but I feel so much better, and I want to say that it's from getting them removed because I tried so many other things before. You know, I've tried the getting more sleep, doing things to help lessen your stress, reading and meditating, trying not to worry about everything. I worked with a functional medicine doctor. I took so many supplements for months. I had my blood work drawn, and everything was normal. I tried so many different things that I think now that I'm feeling so much better, it has to be that.
Right. You could not unplacebo your face, right? How you look, right? You did not get laser on your face or a peel, right? And your symptomatic improvement and all of this is all consistent with the literally thousands of other ladies who have explanted successfully and are saying the heal is very much real. Now, I want to go ahead and request my listeners to go ahead and please ask any questions for Taylor. This is your chance to ask any young moms who are nursing, who are interested. Please feel free to ask Taylor. We're very grateful to her for sharing her journey, raising awareness, bringing about hope to a lot of people who are looking for answers. You know, feeling sick, no answers, it could be the breast implants, you know, so as simple as that. You do your homework, follow the Facebook group page. I just want to mention the single most important thing as a plastic surgeon, you have to ask your plastic surgeon to show you the pictures and the videos of the chest wall showing complete removal of the whole capsule. Because if that was not done or shown to you, it was not done. And yes, it is totally incomplete and inadequate to just write it down that the end block or total capsulectomy was done. This must be shown and documented via high definition video and pictures of the chest wall showing complete removal of the capsule, and then the capsule is being sent to pathology so that we know that it was not that very rare BILCL, that all of that capsular burden was removed and that all of that inflamed tissue around the capsule was removed, so you have the peace of mind that all of it was removed, number one, and number two, all of it was tested. Now, there are some patients who have gotten explants and partial capsule and they improved like 50%. The patients know deep down within they're still hurting and they could certainly improve, and they can, even because they know their body the best, they know that there was capsular tissue remaining behind. It is incomplete, inadequate to cauterize the capsule. It has to be completely physically be removed such that there is no burden remaining behind, and that is the certain etiquette. And the surgery can be done definitely in a very defined way without the need for drains, without the need for the unnecessary lift, especially someone young like you. Even though you had the 350, the twilight deep sedation, the capsules were sent to pathology, cultures were done for bacteria and fungus. You got the high definition pictures and videos, and you basically have the implants, you had the implants returned to you. So you have that peace of mind that everything was done, what I call the con procedure, so that whatever was done for you was done in a systematic way for all the patients that I've operated on this past year, the year before, all the 5 years, so that everyone else and you have the peace of mind that the surgery was done in the manner that it was described. Any other questions from any of the other social media posts?
No questions for her in particular, just one asking if you perform a lift at the same time.
So for me, or so
That
basically,
was in, I'm not sure.
yeah. So the question here is this: today, that 78-year-old lady that came, the nurse, she did not need a lift because her surgeon did a great job. I was able to remove that excess skin. Her skin, even though she was 78, recoiled relatively well. Her implants were not that big, and her surgeon was an A+ surgeon who was trained well. And the point I'm trying to make here is, in vast majority of the cases, the implants, when removed, the capsular tissue removed and the inflamed tissue removed, the need for the lift is not there. And I say this definitively. I will tell you, I love to operate. I would love to do a lift on everyone. But as you can see in the 89-year-old patient that I did a Facebook Live on the 14th of April, and then subsequently I did she did not even need a lift because her surgeon did a good job. And you would think at 89 she would need a lift, and she truly did not need a lift. And the vast majority of the patients, if you ask me, well over 80% do not need that unnecessary lift, period, between the recoil of the skin and the breast tissue. And in your case, the fluffing of the breast tissue, now that the implant that's causing the breast tissue to diminish and atrophy, now the breast tissue has a chance to, quote, expand. Now that the implant is removed, the breast tissue is not being pulled down by gravity and recoils between the internal sutures that I place that lifts the breast tissue up, and between the 10, 15, 20% muscle mass that the ladies, the patients add to their chest. Now they do not need that unnecessary lift. Conversely, those patients that have had a lift, I want each and every one of you to please go to YouTube and type in mastopexy intraoperative operation, and you will be, you will be surprised as to how invasive that is, cutting around the nipple, cutting the excess skin, and then suturing it together such that you have what is a lot of scarring underneath and altered sensation around the nipple, hypertrophic or hypopigmented scars, up and down scars when you do a self-monthly breast exam that might obscure a mass. Fat necrosis sometimes can occur depending on how the tissue was moved around. Some patients, small subset, have reported some nipple necrosis or wound dehiscence because there is too much tension around the nipple areola. And some patients even have what is a altered or a concerning mammogram because of scarring that may obscure a mass, and now they're looking for ultrasound or biopsies. And this has been consistently shown. So a mastopexy, relatively straight up forward operation, not advisable, in mass majority of the cases because number one, the patients don't need them. So now I will go ahead and Taylor, a question for you. Did you interview or talk to any other surgeons? You said you talked to a couple. Now, were they going to remove the whole capsule or no?
One said, well, they both said that one said no, he couldn't promise it, so he didn't sound very promising with that at all. But another said he would try, and that he does remove the entire capsule, but he couldn't promise that it would be done in blood.
Oh, God, okay. Now remember, yeah, and see that there's two requirements to an explant. Number one, the surgeon must be from mentally determined, committed, sold on the entire capsule, 100% total capsulectomy in en bloc fashion, or 100% total capsulectomy must be done, so that the surgeon must be convinced that that is the operation that must be done, because that is the operation that's going to give you the freedom from the silicone toxicity. The second thing is the surgeon must be able to carry out the operation, and this is where the video and the pictures of the chest wall must be shown. And so these are the ultimate two definitive, complete understandings that the surgeon is going to do it right. The other thing I just want to mention, there's 5 things. The surgeon, number one, the diameter of the implant dictates the length of the incision. So another patient had a small incision and supposedly got an en bloc. That is virtually impossible because you have to have the size of the implant essentially dictates the length of the incision. Number 2, the length of time of the surgery. One patient got her surgery in 90 minutes. Cannot be done that fast. For me, on average, 4 hours plus minus, I book my patients. Number 3, the implants are always returned to the patient. There are many times where the saline implants are punctured and the implant is removed. I talked to a lady over the weekend. She had done exactly this. She went to a local plastic surgeon who punctured the implant and removed it under local, and now she has residual capsules. Absolute no. The whole capsule must be removed with the implant as en bloc or 100% total capsulectomy. Number 4, I send the capsules off to pathology because that's the proof that that capsule then can be measured, quantified. It gives me whenever the capsules are sent to pathology, the pathologist measures the capsule and documents the grams and the size. So now it becomes a part of a permanent record as to how much of the capsule was removed. There was once a pathology report that it was 3 by 4 centimeters, roughly this much of an area. And I said, this is not good enough because the implant was much larger, like 400 cc's. And so you should have at least 9 or 10 or 11 centimeters of the capsule removed. And number 5, the surgeon must be actively talking about BII, breast implant illness, and how he or she is doing it. If you go to 10 different plastic surgeons, without a doubt, you have 10 different ways of doing it. And you do not want to be finding out post-op, did my surgeon get it out or not? You should be firm, and that confidence must be there that your surgeon believes in BII. I have had some patients who went to another surgeon and the surgeon said, I don't believe in BII, but I can do your operation. This is not your surgeon. Or the surgeon is putting in implants. You have to be super cautious. You have to be very cautious. You do not want to be doing fat grafting in someone who's nursing, or fat grafting at all, because remember, some part of the fat absorbs good, some part of the fat gets absorbed and liquefies, some part of the fat forms clumps of that fat, and that might be erroneously taken as maybe a mass or breast cancer, and now unnecessary biopsies are done depending on the surgeon technique, how the fat is layered. And fat grafting to the breast, I call in my practice malpractice, because I do not recommend it. I feel that when the patients do the self-monthly breast exam, they get these irregularities, sensation changes, masses sometimes that are notable on mammogram or a self-monthly breast exam. And now 1 out of 8 or 9 women who get breast cancer, you're not able to detect for breast cancer optimally. You have to be very careful. You have to ask, if you have a group of plastic surgeons, you have to ask, because what some surgeons have done, one surgeon is dedicated only in implant removal. So anyone who asks, they say, well, he's only removing, so this is all what he does. That's not good enough, because the whole group collectively is financially benefiting, because they're marketing that surgeon as only an explant surgeon, but deep down within, they're diverting traffic. I heard about another surgeon who says, well, he explants 90% of the time, 10% he does not. Who has had the chance to review the last year's records, for example, to show if that's even true, right? And so this is where the patients have to do the homeworks. This surgery is all about integrity, honesty, confidence, and that absolute confidence that when you do sign up for the surgery, you're very much at peace with your surgeon, that you have not talked to the nurse or the nurse practitioner or to the medical assistant or the office manager or the medical assistant or the receptionist. You have talked to the surgeon directly, so that you have gotten that feedback directly that your surgeon has removed it completely, wholeheartedly, and sincerely. Now let me ask you one final question, and then I'll have you wrap up. What advice would you give to someone who's listening, who's gotten implants, and what should be how should they prepare? How should they learn from your experience?
If they have implants.
Yes, or if they want to get implants. A young lady, 22, in college, who just, graduated, she got her first job, and she's like, well, this is what I wanted to, how I wanted to reward myself.
Just to tell her, to love herself, and she doesn't need it. I think that's a hard question, because I try and think back, when I was 22 and getting implants, could anybody have talked me out of it? And I don't know, but I would have liked maybe for someone to try, if I had someone close enough to me that could told me the right things. I don't remember my surgeon asking my 22-year-old self if I was planning on having kids.
Now, did your surgeon discuss with you all the quote detrimental effects of the implants? Were you made aware that they are not lifetime devices, breast implant, unless their association rare with that very rare lymphoma? Yeah. And so this is part of that informed consent. Yeah, and this is where the patients need to, and this is wrong. If someone were to get a pacemaker for the heart, you have to tell the battery might run out. These are the risks you can get, what to look out for, right? Or be it a hip implant or gallbladder removal. In this surgery, the patients must ask and must be made aware. So there is like a professional plastic surgeon, professional feedback, so he or she tells the patients what are the risks of getting implants, and the patients themselves have the responsibility of looking into as to what they're signing up for. Because if you look at the medical field, and I will say this boldly, If you talk to any doctor, nurse, occupational therapist, respiratory therapist, any nurse practitioner, physician assistant who works at the hospital, the medicine in the United States is unfortunately a big business, and it is directed by dollars. The insurance companies dictate and govern how and what the next move of the doctors and the hospitals are going to be, because they're the ones who are eventually paying. They have, unfortunately, the power to say no, and no one can unfortunately question them. There are some checks and balances, but these are very poor, and unfortunately the patient's interest is not out there. They're still to this date sold as they're relatively very safe. No one truly discusses the risks versus benefits, and if everyone were to find out, you would basically, no one would want to truly get an implant if there was any mention of the risk versus benefit. So it is important for the patients to do their homework and to understand, and for the surgeons certainly to talk about the detrimental effect of the implants, so the patients know what they're signing up for.
I think for all of us, that have been through this, that have symptoms, that, even before they have an explant, anybody who knows that this is a thing, I think we all should. I mean, all we can do is tell our stories and, let people know our before and after, how I felt before, how I feel now, and just let them know that heal is real and there are risks with getting implants, and let helping people be informed about that. I would have liked to know all of this was a possibility before I went down this road.
Right. No, I will tell you, the patients are very smart. You
I've had several friends tell me, or people I know that I've gotten my explants, reach out and say they wanted boobs, and now they don't want them anymore.
Right, no, very good. An ounce, of prevention is better than a pound of cure, and preventing it is huge. And look, I heard over the weekend, Charlie Sheen's daughter and Denise Richardson's daughter, she's 22, as I understand. She has implants, and she very clearly stated on social media that she has implants just for 3 years, and she's hurting, and she was able to put the two and two together, and now she's wanting to get these removed. And the patients, and I promise you that she very likely did this homework all on her own, just kind of putting the two and two together and determining that these implants were the ultimate cause, because she's too young to have all these problems that the patients present with. Yeah. So I just want to go ahead and read one thing, and I will finish. These are the FDA guidelines. You can Google this. I will bring it up close so you can see. And as you will see right here, on page number, I'm going to read two respective parts of it. And these are what every surgeon needs to discuss. So on page 13 at the bottom, and I'm going to read, quote, systemic symptoms. I understand that some patients who have received breast implants have reported a variety of systemic symptoms, including joint pain, fatigue, which you had, a rash, memory loss, and brain fog, that some patients have called breast implant illness. While the causes of these symptoms are unclear, some patients have reported relief of these symptoms with the removal of their implants and surrounding scar tissue capsule. However, not all patients may experience improvements in their symptoms. And I just want to go ahead and mention this. This is not my words. I didn't type this. It says, I also understand that some patients with breast implants have reported health problems in their children after birth or breastfeeding. And they want you to put the initials, patient initials, that your surgeon told you. And then breast implant specific risk. I understand that breast implant is not a lifetime device, and the longer I have my implants, the more likely I'm to experience a complication, and the more likely I'm to require a reoperation requiring the replacement or removal of my breast implant. As many as 20% of the women who receive breast implants for augmentation have had their implants removed within 8 to 10 years. Then I must mention the next line. This is also important. I understand that silicone can migrate from my implant into nearby tissues, chest wall, lymph nodes under the arm, and organs, liver, lungs, where it may not be possible to remove. I understand that all breast implants can interfere with mammography and breast exams, which could delay the diagnosis of breast cancer. Mammography can also cause the breast implant to rupture or leak. And then it says, patient initials right here. And it says, I understand that all breast implants contain chemicals and heavy metals. I understand that most of these chemicals stay inside the shell of the implant, but some small quantities have been found to diffuse gel bleed through the implant shell of silicone gel filled implants, even if the implant is intact and not ruptured or leaking. A list of the components, chemicals, and heavy metals is available in the patient information booklet brochure. And this thing over here, you will see that it lists what are the chemicals: magnesium, mercury, nickel, platinum, selenium, silver, tin, titanium, vanadium, zinc, arsenic, barium, beryllium, cadmium, chromium, cobalt, copper, lead. And as you can see, we have the data out there that breast implant illness exists. The papers are telling us, we know this because the patients are telling us. If you forget everything and just listen to your words, I will tell you, not hundreds of thousands of ladies, millions of ladies all over the world who have implants, who are hurting just like you, who got them 5, 7, 10 years ago, and who are looking for answers and are now going and getting these quote arrhythmias. Not all of them, small subset. Remember, BII, breast implant illness, does not afflict everyone, but this is where it's so subtle. The very last patient that I saw today was a post-op patient, and she gave a video testimonial. She works at the hospital, and she said, my God, I thought I had no major complaints or symptoms, and I saw the throat trickle improved. I saw that improved, and she thought that was part of the aging process, and indeed was part of what is breast implant illness. So it kind of tricks and deceives and fools the patient into thinking this might be perimenopausal, postmenopausal. This might be the stresses of life. This might be the underlying problems, that everyone goes through, and no one wants to blame the implants, unfortunately. Yeah. So, what do you have, Taylor? Any last-minute thoughts? Anything on your mind?
I know a couple of people have asked me, how I did how I handled my baby with the weight restrictions and breastfeeding him, and that requires a lot of support too. I never picked him up. I always sat in a chair. My husband brought him over to me, helped me get unwrapped and placed him there. So I never held him, never picked him up. And then my husband would take him away. So that was a big joint effort, and it takes a lot of support.
No, I will tell you, thank you very much for listening to me. And thank you very much for investing in your recovery. The most important, I always tell my patients, 50% is what I do, the 50% is what you do, and it comes to the recovery. So for example, someone got a knee replacement, but 2 weeks later they start walking on it. That's not good enough, because what was the point of doing the best surgery when there is non-compliance?
I was doing this for a reason, and so I wanted to heal too. I wanted to be able to feed my baby, but my health was also important, and I wanted to get better in the best way, and that was so.
Right, and you now can play with the baby, you can do everything, you're healthy, you look amazing, and as far as overall, you can see the color on your skin and overall the improvements that you mentioned. And now you've moved on. Sometimes, I tell the patients, people are busy. Like the one patient, she was researching, the one nice lady from Scotland that I interviewed earlier today. She's been researching breast implant illness in 2014, and now 11 years later, she decided to get the explant last week, and we had her as a guest Facebook Live. She was one of the patients I did last week, and this is very similar story as yours. And she knew in her heart that these were the implants that were ultimately hurting her, and she knew that she was going to bounce back, and she had the peace of mind and confidence, the nice smile on your face. I remember in pre-op that and your husband was there, that we knew that this was good health right around the corner. No, thanks. I just want to mention one last thing. There was a lot of questions about bloating. Did you get any bloating?
Yeah, I did.
Yeah.
Right after, and it probably lasted about a week. And I searched on the group, searching for that, and I saw other people talking about it, and saw that it could be a common symptom, but it did go away after about a week. But it is concerning, when you see that.
Right. Now, one thing that I want to mention, 100% the capsule was removed along with the implant. Number two, all what was removed was tested. Now, I talked to a gastroenterologist yesterday at the hospital on Sunday, and GI doc, I sat down with him over a short cup of coffee, and I asked him, this bloating in my patients post-op, what is this etiology? Where is this coming from? Now, he's the GI doc, very serious, professional, very nice, dedicated, committed, there on a Sunday taking care of patients. He said it's a very non-specific. Now, sometimes when you give the antibiotics, that can alter your GI tract. But look, how many of us take for a pneumonia or a ear infection or a UTI antibiotics all the time, right? Do we get bloating? No, it is part of, remember, they are biofilm forms, so I have to give the antibiotics. Sometimes the pain meds can slow your gut down, or the anesthetics can slow your gut down. Just the fact you travel from Arkansas to here will alter your gut pattern, right? Now, one thing that one of my patients, and again, I learned from my patients too, she said something which we all know, that one patient had irritable bowel syndrome, diarrhea, constipation, and the GI tract that was hit negatively. There was another patient who could not tolerate dairy, pizza. Another patient who could not tolerate some certain types of foods. There was food chemical sensitivity. These are my patients, our patients that we see on my private breast implant illness support group. You will see that the entire reaction by the implant is what? It's an immune response, right? The body is recognizing overall the implant is foreign, and you have the histocytic reaction, giant cell reaction, you have the nucleated giant cell reaction. So this is a inflammatory response. The GI, the gastrointestinal tract, is an immune system analog, if you will. It is an immune system where, remember, whatever you ingest and there are bacteria that's harbored. So the gut is very much integral part of the immune system. And I can only imagine there is a component that's out there that has something to do with the post-operative recovery with regards to detox. How much and what is what, I do not know. Because this is a finding that is real. The patients present that they're bloated. And, so the gastroenterologist said walking, which is what I have recommended my patients. The day of the surgery, you're out of bed to chair. The next day, you're gently walking. He also recommended getting Miralax so that you have fiber, lots of fruits and vegetables, water, and this with the regular bowel movement is going to help return the GI tract back to its normal sense. But there is nothing that I can do or say that's going to help provide or do something to give this relief. Now, the other thing I want to mention here is, to be complete, a colonoscopy at age 45 is required. This is kind of the American Cancer Society. They're finding colon cancer at young age. So now they have recommended 45 years of age. The other thing here, so if you have not gotten one, get one, just to be complete, right? And then, you have to always be, there is SIBO, small intestinal bacterial overgrowth. You have other problems that can potentially occur. Anyone who has taken my antibiotics that I've given who has loose stools or diarrhea must stop, because you have to always think C. diff. But to address this bloating, he's recommended Miralax or any of these high fiber basically components, so as to help allow for a regular daily GI bowel movement. So this will help certainly with the bloating. But again, a very non-specific finding that I find in my post-op patients, and I feel in my gut, if you have addressed all of this with the above and you're still bloated, this very likely has to do with which would be a detox. Now, this is not a contraindication to proceed with surgery, but remember, this is quote aftermath of what is another entity that is affected questionably post-op, so that the body is recovering with the detox phenomenon.
I mean, that makes sense to me.
So there's nothing ill will, there's no harm that occurs. It's self-limiting, and especially with the daily bowel movement, lots of water, fruits, vegetables, high fiber diet. Just Google in anti-constipation foods. You will see Google will tell you 10, 20 things, from grapes to olives to figs anything high fiber, take it. I promise you, you'll never be constipated. And if you ask me, all of the United States should be doing it because constipation and GI issues are very much a U.S. problem. A lot of patients have anxiety, depression. Some, so this kind of adds overall to the gastric dysmotility that unfortunately occurs as a result of the psych problems that some of these implants can cause, the psychological issues of what is breast implant illness. Not all, but a good number. All right. No, thank you very much, Taylor. It was a pleasure to have you on. Say hello to your husband and say hi to your cute baby. I remember, I do remember holding him up. So more than 2 pounds for sure. Yeah, yeah. No, very happy, healthy, smiling baby.
Yes, he's still all those things, just a little bigger now.
Yeah.
I appreciate you and just your knowledge, guidance, and support through this journey. And I hope I was able to help people or answer some questions or at least help people do some of their own research. I appreciate your time.
No, thank you. Do your research, do your homework. Feel comfortable signing up. Most of the patients are excited about the surgery, just like Taylor was. Well, take care. All the very best. Till next time we meet again. Bye bye.
Thanks so much. Bye.
Bye bye.